Hello everyone, it's lovely to be here again, and I recognise a number of faces from last year, and I think it's doubly exciting for me to be here this year. Firstly, with those of you that were here last year, we set out a journey of what we expected to happen at a national level throughout the year, and this year I'm back again and I can go, we achieved all of those things that we said we would. And because you were there hearing it last year, you can either say, excuse me, you didn't say that last year, or actually, you're right in what you're saying, we have moved on. For me, last year, I said I thought that the health visiting programme was probably the most exciting thing that had happened in my career in terms of the dynamic way that it was moving forward and the biggest change. And I said that it felt like winning the lottery because it was the one change that would enable us in the future to change the lives of so many for the children, the families and the communities. Well, 1 year on, I'm pleased to say that the government commitment is still strong, and it is as strong, and I would even say it's stronger than it was before. We started with that strong political steer, and it is still a strong political steer. What I had in my slides when I put them together was very much a set of slides that gave a list of all of the things that have happened, and I thought, well, I can tackle this as the football results. We had 26 early implementer sites. We did increase the number of health visitors by, but I'm not. I'm going to take you through some of the detail about the things that we did, because it is a really exciting set of things to see moving on. Before I go through the list, I would like to say that it has been very much, though, a year of scene setting. Very much a year of getting commitment from stakeholders all over and from all across the country and inside and outside of the profession. And it has been a year of increasing understanding, which is always important in massive transition, to get that understanding and that commitment to get the change that's needed. So it's been a year of readiness. And some of your indications earlier were that actually we know a lot more than we did last year. We're hearing it from different places is an indicator that that message is getting out there. So the health visitor implementation plan was launched and has been well recognised and well received across the country by all groups of people and responded to by commissioners, higher education institutions, professional bodies and the government. We've been really lucky in that we said we would launch some early implementer sites, and we did launch 20 early implementer sites up and down the country, and they've received an awful lot of support from a national perspective in terms of some development work that was going on, in terms of leadership, understanding some of the evidence-based programmes that are about, and also in terms of just supporting people to think differently about the work that they're doing, despite the fact that in the early years capacity has not grown dramatically. So that's been quite exciting. And since then, we've also added another 6 early implementer sites. So growing at pace, which is really good. And you'll hear more about those later on, about the one here anyway. We said last year that we would begin to develop some tools that would help to refresh the current workforce in the skills of working in communities and how to take projects forward to influence outside of sphere of knowledge and to bring together community resources. And that was a building community capacity programme. That was pulled together, it was piloted, and the results of that have been that it's been very successful in that the product itself, the information is exactly as needed. The project base that it enables people to develop has enabled the service to move forward. So that has been received favourably. But we recognise from that pilot that we needed easier access to the electronic materials. And so we're working on that. The national rollout has started, and each of the SHAs has been given some money to help support that rollout of the Building Community Capacity Programme for all health visitors to access. We said that we would work with higher education institutions and that we would look at the programmes that they deliver to student health visitors to make sure that they were not only fit for practice but fit for purpose for the future, with a focus more on some of the parenting, strengths-based approach, maternal mental health, neuroscience, many of the elements that you said, actually, this evidence base is growing and the programmes don't necessarily reflect some of those elements. And what we developed alongside working with them are two products. One of those was Educating for a Transformed Service, which gave a rationale for why the programmes needed to change. And the other was a Return to Practice framework, which enabled consistency across the country. They have received a number of hits and probably been the most well received of many of the products that have been developed in year. We've also in year asked King's College London to look at 3 pieces of research for us. What do the families think of our service? What is the evidence around health visiting? And also the third bit about what makes people want to come into the profession so that we can get the marketing right for the future. And so that will inform, come September of this year, further work going forward, which is excellent. In terms of raising the profile, I said last year we needed to get hearts and minds that were committed to health visiting. Unless you really want to take this agenda forward while it's hard and your heart and mindset isn't there, it's not going to happen. So lots of stakeholder activity took place. We have been doing and supporting leadership programmes. There has been the creation of a health visitor task force, which has directors of lots of wide-ranging stakeholders on that, led by Dame Elizabeth Fradd. And they have been pulled together to act as the champions, but also the challengers of the programme, to make sure that moving forward, where we do hit some blocks, and there will be some, it's not going to be easy, that we will be able to move forward. So lots of work there. And also in that raising the profile, we have been doing a lot of work with the foundation years, with DFE, with For Children, to try and get the agendas matched up on the children's agenda. And for those of you that have looked at it, the foundation's years document came out, and that was a joint document pulling together education and health moving forward for young children. I think it's also worthwhile mentioning that in terms of some of the things that we've done, that there has been a lot of work around leadership and governance and performance. We know that moving forward, we cannot get to where we need to be unless we have strong leadership at local levels. Well, there's been the establishment of the PCT cluster nurse directors, and they have been tasked with making sure that this programme goes forward in the future. We also hold and have held throughout the year events for the SHA leads to come together to hear what's going on nationally, to help understand what the local challenges are and to move that agenda forward there. And that has been helpful, I think, for both parties understanding what are the difficulties and working together to find solutions. Well, as if that wasn't enough, we've done more, she pauses to say. In terms of the numbers, success and a little bit of disappointment, I think, in terms of that. We did some national recruitment, but that was fairly low profile last year. This year we're moving to marketing and high profile, taking forward and marketing of health visiting for recruitment at a much bigger pace to fit with 150 years. But there was some recruitment drive last year on return to practice and trying to get people into places for September of last year. We had 540 newly qualified health visitors last year, and I'm pleased to say that jobs were found for all of those. The disappointing news was that we had more people leave the service than we expected last year, so the numbers didn't grow significantly in the year one. Well, we knew it wasn't going to be significantly, but it was a marginal growth, which has been disappointing. But we are training 1,800 this year, 1,600 already on programmes and running at this moment. We're about 200 short, but we are recruiting for second cohorts and things, and we're optimistic that we will try and meet that. We've got about over 2,500 places for next year. And so when you begin to see the extent and the expanse of that growth, that's going to be really exciting in terms of capacity to really change when they come out of training. I think it's really important to say that in terms of professional mobilisation and partnership, that there was a lot of work to try and get the current health visitors to understand what the new agenda meant. Why is it different from what we've always done? How is it going to be different for the future? And I think that's been responded to differently in different places. There are some places that are being really dynamic in delivering the new. There are some health visitors that are still working in old ways and need to move forward in how they change. And we know that practice teachers are going to be key in trying to be that influence, that leadership and that challenge and change for the future. So lots of work will be ongoing this year in getting the practice teachers upskilled, ready to work in new ways with the students and ready to deliver high quality clinical placements, but with a team around the student that understands exactly what's going on. In terms of communications and media, we had said last year that we would do a lot of work trying to raise the profile through articles in a range of journals. We have achieved that, and we've got a comms plan for next year, well for this year that we're in now, to drive and take forward almost something that's monthly coming out in journals, news publications and others, so that the profile continues to grow stronger and the commitment grows over the year. Having said that, I do want to say before I go to the forward look that when I've spoken to people, and as Dave pointed out and others earlier, I do get about a bit up and down the country, I do want to say that people have been reporting from we've heard it all before and nothing will happen to we're beginning to believe it. We're beginning to see a difference. And I think that's really important because sometimes just that belief that things are changing enough to give you that strength to go on when times feel difficult. So that's been really helpful. And we have also been hearing on the kind of supply and demand side going round that there are more people interested in health visiting than there are places on courses, and that the calibre has been very high. Some places saying 78 people coming forward for 8 places. So really good and strong messaging for the future, which has kept me energetic and lively throughout the year and also for the coming year. In terms of a forward look about the supply and demand, I've put about the supply and demand on the forward look for our concentration for next year because we recognise that we have to keep a really close eye at a national level on the reality. Is it really happening in practice? Have we got the number of commissions that we're saying? Have people gone into training? Are the number of practice teachers sufficient to support the students in training? Have we got jobs being advertised to ensure that people go into those posts subsequently? So it's very much about that need to be assured in the work that's going forward, that the supply and the demand is going to be matched up. We have got a minimum data set which enables us to look month on month at how progress is being taken forward, but we also recognise that there are some levers and incentives needed in the system to give it a kickstart because financially everywhere is challenged. So we are beginning to look at what could help support and develop growth of practice teachers. What can we do in terms of enhancing the opportunities for people to get jobs at the end? So looking at types of secured employment. And I'm not going to say guaranteed employment because obviously people are training in different areas and it might not be the same for all, but looking at things that will help that to work in practice. We're running a series this year of careers events and they have been extremely successful. Those careers events have been oversubscribed and we intend to run them again later on in the year. We could have filled them 3 times over and the calibre of the people and the excitement in the room has been absolutely fantastic. And we're also looking at what we can do to encourage people to stay in the profession, to keep the expertise in the profession while we're moving forward to when we will have quite a young and new high proportion of qualified health visitors. We need to keep the expertise there and to help people. And we're also doing work to look at what can we do to support people in the first 2 years, stronger preceptorship and support around what that development might look like to encourage people in the first 2 years. So lots of work going on supply and demand. Also, I must say that where we are hearing that people are struggling, please let us know about things, because when we heard people hadn't got jobs last year, we did work with the strategic health authorities and those people did get jobs. So unless we know about where there are issues, we can't put them right. So we do need to always know to keep that supply and demand aspect flowing. In terms of aligning the delivery system, You would be surprised if I didn't say that this year was going to be an absolute year for making sure that we are strengthening all of the frameworks that enable us to prove that health visiting is as it should be, that during changing commissioning structures, through changing organisational settings, through elements where there is changes from whether you're working in children's teams or public health or wherever you're working, we need to make sure that health visiting is strong and that it remains strong, so that in 2015, when the health visiting national push is finished, that we have a sustainable service. So there's lots of work going on which is around strengthening that commissioning, the commissioning frameworks, preparing for the operating framework, that's been done, but also making sure that we have outcome measures that really demonstrate the effectiveness of health visiting. And making sure also that we're looking at technology so that people are more productive in their work, so that they can be more responsive, so that they can work in the community with the technology that they need, but also that different systems are better placed to talk to each other. And we're now working with lots of young families, and we've got a lot of us that are perhaps a little older, like myself, in the profession, that are not used to using apps and, working with people through different mechanisms. And we need to do more and more of that for the families that we're working with. So lots of work there. And also the cross-government work continues. Really important that we get that partnership. This is about children and families, and we can't do it alone. So lots of work still going on the foundation years, and that's continuing. But particular work around the 0 to 2s and where education fits, and the carers around that, but also the 2.5 year review, and making sure that we have something strong that is piloted, and that's been piloted in some of the EIS sites, to make sure that we pull together the children's centre information, the education information, and the health visitor review information to get a better picture, better strength for moving forward. Here's some of the things that we've been doing in terms of the transformation of the service. Many of them I've spoken about. What I haven't spoken about is the fact that we are and have got a website where we're putting on best practice, so we can begin to share the learning that is going on across the country. The early implementer sites have got some fantastic projects going on, but others need to know about them. There are lots of tools being developed. Everyone needs to know about those. Pathways are being developed and are being launched imminently, and those pathways from a national level look at midwifery to health visiting. Last year, that was something we looked at, and people said we really need that to be stronger, the antenatal work. And also from health visiting to school nursing. So those pathways are going to be launched imminently. But we're also in year doing other work on maternal mental health pathways and safeguarding to make sure that there is more professional clarity out there. Joint training, we're looking at what opportunities there are, in particular to work with others. We know that if we're working alongside other partners, particularly in children's centres and with other professionals, joint training is essential for moving forward together. So that partnership working is absolutely strong. And we know that the public health outcomes need to match with the children's outcomes later in the year, and that they need to be strong and coordinated. So, in terms of the future and moving on this year, it is very much about strengthening relationships and connecting people. It is about delivering strength to what we've already started and working with partners and doing more of the work that we already have done. But having said that, it's going to be another challenging year. And I said last year when I ended my presentation that in terms of things being a challenging year, that I better move back to my slide, hadn't I? That my granddaughter says to me, "Come on, Grandma, let's just do it." And I said, "Well, let's just do it." Well, I've got an exciting grandchild story to tell this time for leaving you on. Just recently, she rang me and she said, "Grandma, I'm a mermaid. I can swim upside down and all over, and she's only just four. So she said, "And I can swim, you know." I said, "Oh yes, that's lovely." Thinking, oh yes, lovely stories from your granddaughter. And I spoke to my daughter and she said, "No, she can't. She toppletails in the water, but of course she can't swim." Took her to the swimming lesson that Sunday, and she told the instructor, "I can swim, I'm a mermaid." So I said, "All right then, you show us all, how to do it." So She got off the bottom, she swam half a width, put her feet down, swam the other half of a width. And she said, told you I could do it. So we told you we could do it, and we did. So are you going to be with us in the coming year? I certainly am. Thank you.